Welcome to Founders Future, a podcast by Closers.io, where we dive into the journeys of innovative entrepreneurs and explore the road ahead of them and their companies. I'm your host, Olivia Salmons, and in each episode, we'll uncover the stories behind successful startups, the challenges facing them along the way, and the strategies driving their future expansion. Today, we're excited to have Mike Henson, the CEO and founder of Bridge Health, joining us. Mike will be sharing more about his founding story and giving us a glimpse into these plans for future growth. So let's jump straight in. Mike, welcome to Founders Future.
Thanks for having me, Olivia.
No problem. It's awesome having you here. So can you take us back to the beginning? What specific problem inspired you to start Bridged Health, and what solutions were you looking to get from it?
Yeah, so this story probably was 20 years ago. So a little bit of context, I've been in the health and fitness industry for about 25 years. And one day I obviously left the industry and I went into Wall Street, healthcare specific. And actually when I was in healthcare specific hedge fund, was the first time that obesity had been redefined. It was actually covered by CMS for coverage around bariatric surgery. The reason that's important is because at that moment I thought, oh, we're going to see this bridge form between healthcare and fitness. We'll get into this preventative care. And this is 20 years ago, right? That bridge obviously is still not formed because in healthcare, you get paid when healthcare gets paid when you're sick, and in fitness, you opposite. And so a couple of years ago, some partners and I got back together and started talking about how do we solve this problem. And so this problem being that we have this consumer that goes to the fitness center, goes to try to be healthy, self-care, preventative care, but they don't have any alternative options outside of self-pay. Well, I understood a little bit more about insurance, and so did some of the other partners, that we realized we could utilize some commercial insurance benefits to help consumers get more service. So what we developed is we developed this offering, which in essence was this operating system to bridge the gap between the two. To basically with this vision of helping a consumer who walks into the fitness center or with a fitness service provider offer their insurance card and say, do I have any insurance? Do I qualify for any insurance-based benefits, right? And we've put together programs around metabolic care as our first product offering, which allows us to provide physician-guided coaching to consumers who qualify. And the way they qualify is they have a certain level of a BMI of 30 or more, a BMI of 27 plus two other obesity-related conditions or health-related conditions. And so that's what we did. And our goal here is to be able to help facilitate consumers who want to leverage their insurance, who want to leverage alternative care models and be able to get more service while they're trying to work out.
Awesome, amazing. My personal background is in sports and healthcare as well. So I know how much of a big impact and a big importance it is in healthcare.
Yep.
And it's obviously protecting and providing future aspects for your body. So incredible. So walk us through a little bit about the offer evaluation. What is it? What is what you've started doing changed since you started?
Yeah, so just like anything, things take way longer than you plan, and obviously you've got to go through this process of discovering your product market fit, right? And
Mm.
so for us, we obviously started with in a little bit of a different way. We don't really start in startups anymore, at least I don't anymore, and I've founded multiple companies, put together joint ventures. And so what we've done is we've gone out and find resource and assets of existing companies and different partners that we could leverage in this opportunity. So the program that we utilize actually has been around for 4 years. And so that had been offered in self-paid, self-insured employers. And we are bringing it into the fitness channel specifically. And then we wrap the technology around that. So things that have changed within that is that you sort of discover what worked there might not work in this specific channel, right? And our model is a B2B channel. So one of the things we thought we would just be an engine that powered most of these brands. What we come to find out is some of the brands actually don't want brand association in healthcare, insurance, drugs, whatever the case may be, right? And so we obviously have to kind of pivot there, which is then you have to have this alternative option model, which is, hey, we can offer it as Bridge Health and you can push it to us versus your company name Health or whatever the case may be. Another thing that's obviously changed for us is we initially went into market purely as a headless solution. We just wanted to integrate into their app experience. And we quickly realized some people didn't want to make that investment on the integration costs, and they actually would rather just point to an alternative option, even though it's two apps, right? So those are the types of things you learn anytime you start a company. And this is just
Mhm.
part of finding that product market fit. We're still a ways away from product market fit. So, but that's probably the biggest change so far.
Yeah, and I mean, it's great that you've kind of identified and then pivoted from there as well if you've gone through it. You mentioned obviously this is a B2P, so talk me through the sales process. How does this work? How are you acquiring customers to fit the app and then moving on from there?
Yeah. So myself and my partners, we all have a pretty good Rolodex. So we basically have been able to work off our network. And so everything's been actually hand selected at this stage for customers. We're in a little bit of a different process because we're not asking for money and we're giving checks. So the sales process is more of a culture fit for us. So the go-to-market strategy for us at this stage of the game is we obviously know we're going to fitness service providers. However, in fitness, you have brick and mortar, you have digital, you have connected, you have all these different segments. So we purposely made the decision that we were going to go test 5 channels. And what I'm talking about is bricks and clicks, bricks, clicks only, right? And we went out and we did different size. And so once we found the culture fit, we did partnerships and relationships with those people, and we're letting those channels compete against each other so we understand where does the best consumer fit for us, because the model breaks if they don't attend, right? So we still
Mhm.
need to figure out behavior and motivation, which is obviously everybody needs to figure out in every business. And so we're looking at the channels in a comparative landscape like that versus pushing in all in one channel.
Okay, awesome. So again, the breakdown there is great. And then, so from initial, what does this aspect like from initial contact to initial close? Talk me through that side of it as well.
So what does that look like on the B2B side with
In the
our
term, yeah, and the B2B side, so in terms of how are you generating revenue from the from that approach?
Yeah, so what we're looking for is we're looking for customers that have a pretty sizable member base, because what we're doing is we're actually offering this service to their member base. So say you go to a gym as an example, and that gym has 50,000 members of that across that brand. We know there's a take rate amongst that. We know that 65% of that population potentially has commercial insurance. We know that roughly called 70% probably have this health condition, right? And we run pro formas against every customer before we ever do anything, and we actually share it with them. So they know exactly what we're looking at. They know what they're looking at. And then from there, obviously, we have the ability to compensate them for providing services to these customers. We're taking what we would call members of a club and we're making them patients, right? And then we're able to have this partnership between the two. So it's actually a win-win-win for everybody. The consumer gets physician guided coaching over a 26-week program for basically $0 out of pockets because it's getting covered by their insurance. And then on the brand side, they're becoming, in essence, part of or supporting our care plan. And when they support their care plan, we can pay them for services that they support our patient with. So they get paid more money. So it's actually business model innovation, which is exactly where you want to sit. Anytime you can provide more revenue to your customer and their consumer gets better service, that's why I said it's not really a sale, right?
Ab-
And if
Yeah,
you can't sell it,
absolutely.
you have a problem.
Yeah, absolutely. You've got happy customers on both ends. You've got, as you say, the patrons there that are looking to grow and better their lives, and then people generating revenue from that on the other end of it.
Yep.
Great middleman in between.
So it's really a
Um,
marketing play at the end of the day. It's really like
mm,
getting the message out, finding the culture fit with the customer that's willing to promote, that's willing to let people know that these services are potentially eligible. Otherwise, it's like any other partnership, which is what I find specifically in the fitness industry, and we've looked at this data, is just because you have a partnership means nothing. Usually the take rates are like less than 1% on a partnership. When you put a paywall up on that partnership, it's like, hey, we have a relationship with Gatorade, go buy Gatorades. It just doesn't happen, right? But the second you have a partnership where there's culture fit and it's free, those go up to like around 30% if you do it right.
awesome, amazing. So have you kind of encountered, or are there any big bottlenecks at the moment that you're struggling and looking to break through?
There's always bottlenecks, right?
Yeah.
Nothing goes as fast as you want. And then I think at the end of the day, what just like anything, I think partnerships and customer relationships have a lot to do with how the integration is handled. And so you've got an onboarding, you've got an integration, and just because we want to integrate a certain way doesn't mean that fits that customer's business processes or workflows or SOPs. And so you've got this sort of like you want to do a rinse and repeat against a customer, but necessarily you can't always do that. And so you get these one-offs that you got to deal with. And, but I think that's part of the process, right? That's part of the process of deal with a one-off and then figure out amongst the 5 or 6 customers you're dealing with what is common and what is an anomaly.
hmm Yeah. Makes complete sense. So if you could snap your fingers right now and a genie or rub a genie lamp or whatever, and there was one thing to identify that you could solve that would have the biggest impact on your business and on the growth of that at the moment, what would it be?
I'd have our V2 product done because I've identified what the V2 product needs to do to help us solve some of these things and really where I think the product fits because I've had enough customer conversations now to understand where the value is. And the value within those features is scalable. Not to say we're not scalable where we sit right now, but there's more of an operational element than what I prefer to have.
Yeah, awesome. So it's more controllable and it's scalable on a bigger scale to repeat to repeat the word. So how are you what does this look like in 12 months' time? What are the priorities for growing
Yeah,
to the
so
company?
we plan to take the next 6 months to do the onboard and look at the customer data, specifically around that. I think that what happens at that end of that 6 months is we're probably in the position where we're going to be in the V2 because the V2 is a little bit of a lighter product for us. It's a web progressive app on the front end that sort of, spits into these applications. Um, and I think in 12 months, then if you think about that, we should be at a stage where we can actually start an actual sales process where we can be like, let's just keep selling because we don't have bottlenecks on onboarding, right?
Mhm.
That's pretty aggressive, honestly, in 12 months if you think about how many issues you run into. But if we do it in that sequence, we should be at a point where we can obviously start to rinse and repeat, bring leads in and go sell.
Awesome. You did mention earlier there was two apps. Was the V2 running the two apps as well, or is this mainly based on the one?
So right now it's an app, right? What we're trying to do is we are trying to get into a system where we can actually offer a free service. For that free service, I don't want to put friction of download an app. So I wanted to make a web progressive application on the front end that can be just integrated in on the browser, right? On the phone, but we can take care of all the scan. We can collect a lot of data. We can provide value. We're going to provide free complimentary practitioner visits. So that would be the that'd be the catch 22, right? So if anyone's hearing this, they obviously know where we're going to go. That puts competitive pressure against the people that are probably the closest substitute, and they charge. We don't. So
Okay.
when we do that, I want to have zero friction. I don't want download. I want you just go online and do it, and it's right then and there in your fingertips.
Yeah, make it as easy as possible, and then obviously from there, it's
Correct.
always a winning thing. And as you see the health and wellness and the fitness industry evolving in the coming years, how would you say you're positioned in yourself?
So I've been in this industry for 25 plus years, and here's what's happened, and I'll just kind of give you the fundamental shifts. So, moral of the story is the consumer's gone from this look good to this feel good consumer, right? Like it used to be all about six pack abs, and now it's about how you feel. Another thing is what GLP-1s did for this industry is no different than what ChatGPT did with AI, right? Just brought it to the forefront. So we're in this world now where science and technology has just met health and fitness head on. So the terminology that we're starting to see in here is biohacking, longevity, anti-aging, precision medicine, precision health. So that is where the market's going. All of that is self-pay. Majority. We'll call it 85, 90% of it, right? We're sitting in a position 100% understanding what's taking place within that. I call it the world of engineered well-being. We are trying to figure out how do we bring a new business model to that. Well, all well knowing we can drop down into those categories at any point. So I think we're positioned pretty well because most people are still focused 100% on preventative around self-pay. We're trying to figure out how do we actually leverage insurance. What happens is over, say, 2 or 3 years, if we get enough consumers with inside using this, then we have the data to support, right? And then we can say these were the devices, these were the things we were using, which is a very different conversation with an insurance company at that stage of the game, right? Because insurance is basically actuaries, right? Data. And so they need the data to make the decision. Hopefully, we'll have that data.
Awesome. So AI is actually helping you out as a tool to push forward and move through this.
I think AI
Um,
everybody. And yeah, so you can
yeah,
utilize it across the data set within the product, and you can utilize it obviously within the operational side. Yeah.
yeah, 100%. I mean, I've noticed as well the shift from AI coaches to actual physical coaches is immense. So combining the two, and as you say, using that for the data behind the insurance, is a smart play and a smart move. Now, what's one tool or Um, sorry, let me start that again. What's one tool or resource that would be a game changer for your business? Obviously, you mentioned the V2. Um, is there another one that we could move forward and help growth within this one?
That's a good question because I don't have the data back on the consumer side, which is where we want to see where the traction is on that to really say what where the friction is going to be. Because what I'm going to tend to see is like we have a program that happens on a sequence, right? So it's going to be for us, it's going to be about getting the attendance to show, right? So we modeled in a 90% show rate on those specifically. And so what we're going to need is we're going to need tools that are going to facilitate those journeys. And that could be motivation across wearable integrations. It could be product, and it also could be obviously MarTech systems that are obviously doing nudges and pushes and notifications. But do I know what that is yet? I don't know what that is.
So it's just speculation at the moment in time.
Yeah, exactly.
That's great. Okay, and then what would be one piece of advice that you've received about scaling a business that you found so important?
Yeah, so scaling a business or launching a business. I guess the question is what does scale mean to you? And then I'll tell you.
Scale. So I would say, yeah, the startup probably past launching and going into like maybe the first 6 months, 12 months.
Gotcha. So my belief is on the 0 to 1, and what I'm saying is 0 to 1 million, so 7 figures. So I've done it 5 times from idea to 7 figures. And what I've learned is hustle, grit, fail fast, try a lot of things is super, super, super important up to the 1 to 3 million mark. And it's more about the person's DNA and work ethic. I don't necessarily need the guy who's like super smart, knows systems and processes. Those are important, but those come into effect sort of post that, right? I think most entrepreneurs can get a business to 3 million if you just do it right. It changes after that, right? And so you have these phases and stages. And so that scale process to me is literally good old elbow grease and hustle grit and never give up.
Yeah, amazing. I mean, hard work can't um, outbeat a good system. So I do agree with you there. And then for starting up a new business, what would be your one piece of advice to all the founders listening that want to start on their own journey?
Don't get paralysis by analysis. So go out there and sell it, even if you don't have it. Go share the story, even if you're scared somebody's going to steal it. Nobody's going to steal it. So I think the future state of building companies, and this is like way out there for anybody who wants to accept it. The future way that I'm going to build a business, the future way that other people are building businesses is go out there, build your personal brand, get an audience, sell a product to that audience, and go. What happens is now we're in a new world where attention and audience is super important. I started on the personal branding stuff a couple of years ago, and it's night and day difference. It is is way easier. Otherwise, you're going to buy your way to either success or failure, and there's a good chance you're going to spend a lot of money to fail.
Yeah, I mean, it makes sense. So jump in, get involved, and then work hard from there.
Yeah, I mean,
Um,
it makes a ton of sense. At the end of the day, if you have an audience and you have audience that follows you and you put value out there, so on and so forth, right? You can then build a product for them, right? And then you can build a company around there. And you look at the guys that are doing it, and you wonder why content creators have massive businesses now, right? It's because they have the audience and they just
mhm.
made something to sell to the audience. And there, if you look at the numbers, you're 2 to 3x times faster to revenue. You have like an 82% chance increase in finding product market fit. You have all these things that are super, super beneficial. The problem is most people aren't going to put in 6 to 12 months before they start to want to build something because they're like, I got an idea. But the number of founders who don't have personal brands is astounding. And that's one thing that you could fix. That actually would be the next business I would build is how do you help people actually build their brands?
Oh, there you go. You heard it here first. We've got the next one coming, and we'll bring you on in a few months' time and go again from there. Um, so that is a wrap on another inspiring episode of Founders Future. I want to thank you, Mike, for sharing your incredible journey and insight with us today. To all the listeners, if you've enjoyed this episode, don't forget to subscribe to Founders Future via whatever you listen to your favorite podcast. You can also find more resources and insights at closers.io, where we're delighted to help businesses accelerate their sales and marketing efforts through world-class systems and playbooks. Until then, keep climbing, and we will see you on the next one.